welcome back. I am Lady Sweet and thank you for clicking on this video. This is going to be somewhat part 2 of what you need for, you know, leading up to Lipo 360. Now, I said this in the last video, but I'll say it again. I don't mind running my mouth. I am only doing Lipo 360. I am not getting a BBL, or I'm not getting lipo in my legs or anything like that. I'm just doing Lipo 360. I want to wait to do the other stuff for my mommy makeover when I have my kids. So that's a personal piece of information you didn't care about, but let's go on. The place that I'm going to, it's not Media Aesthetics, but they have like Miami pricing. So I have this special for Valentine's Day. It is $3,500, and that's including the 5 lymphatic drainage massages. I said that right? So in this video, we're going to talk about what you need to have done, instructions for the week of surgery, and then I'm gonna go into the night before surgery. Now, I didn't say this in the beginning of my video last time, but this is something that's being told to me. This is instructions that my doctor's office gave to me. So I'm not just making this up. I'm not just, you know, trying to use common sense. This is something that I am following as well. If you have more information to add to it, I would highly appreciate it, of things that you went through. This is my first surgery, so please add it in the comment box, well, comment section below, because the rest of us will be appreciative with all the information we can get, okay? So the week of surgery. Number 1, report any signs of illness to your surgeon. I feel like that should be a given. So I guess if you have like the flu or anything like that, you want to report that. Patients who have signs or symptoms of an acute respiratory infection or unexplained fever 1 week before surgery will be rescheduled. I forgot to mention this in my last video. I'm gonna put a pin in that. So in last video where it said like you can't take like the Sudafed and stuff like that, if they find that in your system, not only will you be rescheduled, but you will be charged for that rescheduling. However, if it's something like you being sick or anything like that, you will not be charged for that rescheduling. So know the difference between it. You can the things you can control and have to be rescheduled, you're going to get charged for it. So play if you want to. Play if you want to. So if you are sick or have like a fever 1 week before, or any respiratory infection, you will have to reschedule, which it can be an inconvenience, but you don't want to fight that, really. Stop shaving areas of procedure 3 days before your procedure. During the process of shaving with a razor, the skin may sustain microscopic cuts and abrasions. You don't want to get no bacteria or anything in those areas. So I don't know, wax a week before because wax takes a little longer for the hair to grow back. If you're self-conscious about that, wax the week before. That way you don't feel as bad. But at the same time, they really not gonna be focused. They probably will be focused on your hair, because even doctors talk too. So people have their stories. But if you feel self-conscious about it, wax a week before or a week and a half before, if it's that serious to you. I mean, I don't know, they just gonna see some the wolf cooch dealing with me. It's suggested that microorganisms can enter and colonize these cuts, thus contaminating the surgical incision site. So this is a somewhat of a side note for body tight, face tight, Morpheus 8 procedures. Discontinue any topical agents including retinol and acids, lotions and creams 3 days before your procedure. So I'm not familiar with body tight, face tight, and Morpheus 8 procedures, but if that is for you, you want to discontinue any type of agents like retinol or anything like that, okay? Move to the night before surgery. You're gonna have your bags packed, be in your Airbnb or your hotel room, because it's about to go down. Have your peoples ready to take you there. Preferably have your prescription medication before you go into surgery. This is on another page, but she also explained this to me. do not wait until after you leave your surgery to get your medication, because you don't want any holdups with the pharmacy, like, hey, we don't have this to fill, and now the person who drove you there and is supposed to be watching you has to go from here to Timbuktu to find your prescription. Try to do this a week. She told me to do it a week before your surgery. Now, if you don't trust your people around you, you know, to have like your medication around, you may have to hide it in another bottle until further notice, but try to do that a week or a few days before your surgery, because you don't want to be caught off guard. Don't wait till the last minute on that. But night before surgery, there is no eating or drinking after 10 p.m. Not even a good old fashioned H2O, high quality H2O, not even that. There's no eating, not even a protein shake. This is not for you to have a liquid diet. This is not for you to try bone broth for the next time. There's no eating or drinking after 10 p.m. I'm being this hard on you because I'm looking at myself and reminding myself. No eating or drinking after 10 p.m. Shower thoroughly with an antibacterial soap. Now, the two soaps that they have mentioned is Dial or it's on the screen. It is on the screen. I did that for you. And also they mention again, this must be like a key point. Do not shave the surgical sites. They must have this issue a lot. Another thing that they also don't want you to do, that it was on here somewhere. One second. So this part is not on my paper, but this is hearsay from the patient coordinator. So CBD gummies is something that is recommended for the pain after the surgery. For the 4 weeks prior to your surgery, do not take CBD gummies, because if it's tested in your system, you would have to pay for the rescheduling. Like I say, I'm looking for it, and I just remember her telling me that, but I don't see it on here. Because I remember when we looked through the list of things, and she was talking about you can get CBD gummies for extra pain control. She said do not do it before. And someone who had came in for surgery, they tested in her system and she had to get it rescheduled. Don't let that be you. So CBD gummies after the surgery. Have the CBD gummies, but have it for after. Okay? Keep that part in mind as well. So I have already went over the 4 weeks prior to surgery, 2 weeks prior to surgery. In this video, we went over the week of and then the night before surgery. The next video is going to be the day of surgery. Okay, so we just gonna hop right into it, but not tonight. I'm gonna give that a break. I will see you in the next video where we will talk about those matters. Y'all, we finna look good for the summer, okay? Our tax checks finna come. Well, if people's tax checks finna come, or somebody finna bless us with the money. It's time for us to look good. We finna take control of our life. We finna stop being scared. It's finna happen, okay? With that being said, I want you to spread love, pursue purpose, and center God, and everything will be a-okay. Bye.